Thank you for listening to Depictions Media Radio.
Dear colleagues and friends, bonjour à tous, good afternoon. As you know, today is a great day for WHO with the groundbreaking ceremony for the WHO Academy. But we also like to think it's a great day for Lyon and France because it makes this great city and this great nation the platform from which we hope to have a huge global impact. The COVID-19 pandemic is a powerful reminder of how critical health workers are and why they need investment, decent jobs, and the most up-to-date information, competencies, and tools to keep their communities healthy and safe. That's what the WHO Academy is all about. It will be a school for the future and a school for the world. Our ambitions are to transform lifelong learning for healthy impact globally. WHO is known for producing world-class technical guidance across a huge range of health issues. But too often, that guidance does not deliver the impact it should in countries. Too often, it sits on a shelf or in an overworked health administrator's inbox and isn't fully implemented. We need to find ways of making sure WHO guidance is applied faster and delivers results faster. Using state-of-the-art learning technologies and advancements in learning science, the Academy will expand worldwide access to the highest quality learning. It will deliver multilingual, personalized learning programs in digital, in-person, and blended formats anywhere in the world. And it will go beyond the transfer of knowledge to building the competencies of millions of people, including health workers, managers, educators, ministries of health, and the general public. The Academy will include a high-tech simulation facility, unlike any in the world, which will use virtual and augmented reality, simulate disaster response and other health emergencies in realistic field conditions. It will also be a center of learning and career development for WHO's own workforce. The Lyon campus, to be completed in 2023, will reflect WHO's values and ambitions. It will be an innovative, accessible, eco-friendly, collaborative, and interactive facility in the heart of Lyon's biomedical district. So once again, my thanks to President Macron, Minister Véran, and also to the city and metropole of Lyon and the regional council for their support in bringing us to this point. We look forward to a very constructive relationship that has benefits for Lyon and France and also benefits for the whole world. I thank you, merci beaucoup, and back to you.
Thank you, Dr. Tedros. Merci, Dr. Tedros, mesdames et messieurs.
Thank you, Dr. Tedros, ladies and gentlemen. In addition to what Dr. Tedros just said, the director of the WHO, well, what has the world needed or missed during the pandemic? Some countries didn't have enough equipment or medication or vaccines, and there were some recommendations put forward by scientific organizations, among which the WHO. We probably lacked harmonization in the way we reacted to the pandemic. We should harmonize our practices and training healthcare workers in different locations, different territories. We lacked harmonization in the way we develop programs of research, whether national or international, that were meant to target one same objective, how to fight the virus, but also how to explore new avenues. And some countries have health insurance, like France has, and they were able to ensure free access to medication, whether tests or vaccines or ICU. And some other countries that didn't have the means to provide that to their nationals. There were some hospitals that had all the necessary technical equipment to react in ICU to very severe cases, and some other countries do not have that, did not have either the equipment or the know-how. So the role of the WHO, in addition to guiding new nations in the face of COVID, the role of the WHO is to guarantee that every state, every nation has the required abilities and know-how to allow them to react at best in the face of that threat. And that is what the WHO is going to do. It's it's no wonder that it is here located in Lyon, because it is in France, which has healthcare, and nobody is deprived from healthcare or medical care for the lack of funds. And France is a country with a high level of training in medical professions and a good network in the field of health and medical facilities. So it's an honor, and it's great for France to be able to welcome the WHO Academy. It's not just one of them, it's the Academy. It's an innovative project that is based on a challenge, the digital challenge. I would like to pay tribute to Agnès Buzyn, who is going to be the executive director of the Academy, because of her know-how and the trust in her scientific knowledge, with a great amount of experience in steering administrations. We will focus in the different programs of training, the focus on healthcare professionals as declared by the healthcare environment that dedicated 2021 to the topic. So dealing with the training and the acknowledgement of healthcare professionals has also to do with gender equity, which is one of the main challenges and one of the main focuses of President Macron's mandate. So it's a wonderful day for science. Science has been put through difficult times, so it's good for training, it's good for the consistency of best practices, so it's a great day for health all over the world. Thank you. Thank you very much, Mr. Véran. Let me tell you that we have translation, and if anybody wishes to listen to translation, there are headsets.
Signaler qu'il y avait la traduction français-anglais et que nous avons le plaisir d'avoir des journalistes.
Translation into English, so any journalists online or in the room who wish to ask questions, they can use the headset and ask their questions.
Est-ce qu'il y a des journalistes qui veulent poser des questions?
Are there any journalists who would like to ask questions from the room?
Oui, deux questions. Donc, sur l'Académie OMS, est-ce que
Two questions. WHO Academy, who's funding what? During his speech, Emmanuel Macron mentioned two subjects: transparency about the prices of vaccines and technology transfer. Could you tell us how those two measures would be implemented in concrete terms? What would the framework be? What's the timetable for that? Maybe I can answer that question.
Le président de la République
What the President said was that the population in Africa, for instance, does not have enough vaccines.
fait partie des grandes puissances.
Even if Europe has provided a lot of vaccines to Africa and to other continents where access was difficult. We've done this with laboratories that produce vaccines. We've donated a lot of vaccines. 120 million are going to be donated by France to the least developed countries between now and the end of the first semester 2022. It's as if every French person were to give 2 doses of vaccine to 4 countries over the coming months. That's not insignificant. As the President said, Europe is the only continent that exported 50% of its production. It's the main donor. There are various mechanisms all over the world that ensure that these vaccines, once donated, actually get to the people who need them. Have all of these vaccines been put to best use as quickly as possible? Obviously, things are a bit more complex. There were discussions in the G20 about this. I was there 10 days ago where we talked about that, and there's going to be a discussion at broader level on vaccine policy. Avoiding losing doses and proceeding quickly are 2 key targets. We have to go quickly because we need to eradicate the coronavirus. Otherwise, there's always the risk of mutants emerging, and then this could cause problems even in countries where there's high vaccine coverage. And this could be the case in countries where there's high prevalence of HIV, because if you have a lowered immune system, then you're more likely to catch the virus. So, obviously, for altruistic reasons, you have to vaccinate the whole planet, but it's in our own interest as well. But the best way to do that is to produce locally. The President talked about technology transfer, and he appealed to laboratories to build factories directly in those countries where the vaccines are needed. It will work better still than exporting the vaccine. Then pricing transparency, procurement transparency, of course that makes sense given that we're all battling the same enemy and everybody is trying to eradicate the virus, so transparency has to be the gold standard. France, 120 million euros into the academy. The local authorities, the town, the metropolitan area and the region are also going to be contributing financially to this wonderful building. And there's a consortium of industrialists, laboratories, but not only laboratories, that are co-funding as well. But then we need to make sure that the financing is over the longer term, but together with the WHO, because then we'll be able to offer more and more training and research, because we have a very ambitious goal, which is to train millions and millions of people worldwide. Thank you, Dr. Véran. Let's take a second question from the room. Dr. Véran is going to have to leave very soon. And could you tell us who you work for? I have a question for each of you. Dr. Tedros, my first question is for you. In France, the booster shot, the 3rd dose, has been administered now for people who are particularly vulnerable or aged over 65. Do you still have reservations about this? Do you think that France should delay its rollout of the 3rd dose? And Minister, in France, the health authority says that co-administration of the COVID vaccine plus the flu vaccine would not be dangerous. Do you have any comments about that? Would it be possible for French people to get both of those vaccines and one at the same time?
Okay, you want to start? Me? So, on the first question, maybe you have Tana to add.
There was a question earlier from you about the investment into the academy and where are the resources coming from. So we're very deeply appreciative for France for mobilizing the resources from the region, from the ville and the metropole together to invest in the wonderful campus, the Lyon hub. And we are also extremely grateful to the French government with the ministries of Health, Solidarity and Health, Foreign Affairs and Europe, as well as the Ministry of Higher Education and Research that pooled resources together to also invest in the Academy's establishment. And finally, we're very grateful to the efforts of the private sector in France through together under the auspices of the Institute of France have come together to invest in realizing the vision of the Academy. So multi-sectoral support made this happen. We're also grateful to the support of the Susan Thomas Buffett Foundation and contribution to the Academy.
Thank you.
Yeah, thank you. So the other question was for me. On booster dose, as you know, the WHO policy is to have a moratorium until the end of this year. And of course, boosters can be provided to immunocompromised individuals. Other than that, we recommend that a moratorium be enforced until the end of this year. Thank you.
Allez-y, monsieur le
Yeah,
ministre.
finish. Very
Sur
short.
Regarding combining the flu vaccine with the COVID vaccine, well, the high authorities' announcement is good news, so that's a recommendation and that's their role, but we need to validate it with the scientific community at large. But, and that answers your first question, the people who are going to get the booster shot are the same people who are priority for a flu vaccine. Because these are people who have a lower immune system. They're more likely to get serious forms of COVID. They're more likely to catch it, but they're more likely to develop pulmonary problems. This is about 10 million people who are being asked to get a flu vaccine, but also to get the booster, COVID booster. There's no problem with this. 120 million vaccines are going to be sent to other countries like France over the coming months, so that's fine. But we need to protect our own population against the risk of flare-up of serious forms, because it's the same people who are likely to get serious forms. So if we can combine the two, and they can have flu and a COVID shot at the same time, then in logistic terms, that would be great, because I've also authorized pharmacists to vaccinate anybody in France against flu, because they've demonstrated their vaccination skills. So we have the resources to do this. Last year, you may remember that we had more flu vaccines than usual, but loads of people rushed to the pharmacies. These were vulnerable people, so much the better, but they all rushed in at the same time. And you remember that there were shortages and there were worries that wouldn't be enough vaccines, but we have more than 500,000 doses left at the end of the campaign. This time round, I want everybody who's fragile, who wants to get these vaccines, to be able to do so very quickly. So when the campaign begins, end of the third week of October, we're going to have 10 million doses, 10 million vaccines ready. We've ordered way more flu vaccines than last year, so that if people do want to have both vaccines at once or a week apart, we'll decide that over the coming days, then they can. Thank you very much indeed, Dr. Véran. I think that was the last question for you. Thank you for participating. Thank you for the invitation.
Maybe?
Yes.
Yeah.
Yeah. Thank you.
Thank you very much.
Merci beaucoup pour les...
Thank you very much for those journalists who are still in the room or online. We have with us today two other experts who can tell you more about the Academy. In the person of Dr. Tana Vuliji, who spoke previously. She is the head of a team for the WHO Academy, and Dr. Jim Campbell, who is in charge of health professionals. So we have online three experts at the WHO, whom you all know. Dr. Mike Ryan, Executive Director of Program for Director. Dr. Maria von Kerkhoff, who is the head of our team on COVID-19. And we also have Dr. Bruce Elwood, who is the special advisor to the Director General in charge of ACT Accelerator. So we have a few questions that were put to you from journalists online. We'll start with Carmen Bloom from Politico. So if you wish, there is simultaneous translation. Carmen, you have the floor.
Thank you for giving me the floor. My question was actually for Minister. So yeah, I can pass. Thank you.
Thank you. So let's go now maybe to Sophie Mokoena from SABC. Sophie, can you hear me? Sophie, South African Broadcasting Corporation. Sophie, can you hear me? Can you unmute yourself, please?
Sophie is no longer on the conference, Fidela.
Okay, so let's go maybe to Jamie Keaton from Associated Press. Jamie, can you hear me?
Hi, Fadila. I'm sorry. Did I see that Dr. Tedros had also left? Is that right?
Yes.
Yeah. Okay. My question was for the minister and for Dr. Tedros, so I don't have any questions. Thank you.
Okay. So I think we have Simon Ateba from Washington African News. Simon, can you hear me?
Yes, I can hear you. Thank you for taking my question. This is Simon Ateba with Today News Africa in Washington, D.C. I just wanted you to elaborate a little bit more on how this new initiative will allow Africans to get access to vaccine, manufacture vaccine and in Africa and train African health workers. Thank you.
Yes, Anna?
Thank you very much. As Professor Agnes Buzyn mentioned in her remarks earlier in the ceremony, the WHO Academy is working on a new set of programs which will really focus on how to build the competencies required to expand vaccination to meet the COVID-19 vaccine targets all over the world, especially in Africa, as we know, but also how we can speed up the capacity for regulatory preparedness for COVID-19 vaccines, as well as good manufacturing practice and tech transfer. This is a program we are working on right now and building partners together. So we look forward to engaging with stakeholders in the African region and beyond.
Thank you for listening today, and thank you for supporting us with our sponsors. Please go to depictions.media for more information and click on our contact link and let us know how we can help bring your story and help bring us to a better world. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.